For our viewers' sake, would you be kind enough to introduce yourself, what you do, and everything?
Yeah, so my name is Beatriz. As I said, I'm from Portugal. I work for a UK-based company, but also for a charity here in Portugal, and I'm a psychologist. So what I do is I help people who have problems conceiving or who have actually been diagnosed with infertility to be able to, work through grief, attain a better well-being, just be able to work through some psychological issues or psychological traumas or any kind of psychopathology that they might have. But it's also associated with infertility mainly. So the cases that I see, it's always for people who are struggling to conceive.
So is your practice, is it limited online or do you do it in person?
Yeah, so at the moment, because I have a lot of international patients, I do it online, and I'm, able to talk to everyone around the globe, and that makes it easier. In the foreseeable future, I'd love to have my own space where I could have people. Yeah, but it would have to be in Portugal, so I don't want to be limited to just one country.
Gotcha. So at the moment, it's online, and we can find you at Beatriz Regina Fertility at Instagram.
Yes.
Correct? Right.
Exactly.
Okay. So, ma'am, in your words, please define what infertility is.
Okay, so I'll go with the World Health Organization definition that after 12 months of trying to conceive, having unprotected sex and without success, then you're considered infertile. But it's actually an interesting question because people think that infertility is just for those who can't conceive. And actually infertility is a spectrum where some people are more fertile than others. So I would say that if people have been struggling to conceive and they haven't been able to have a successful pregnancy, even if they haven't reached the 12-month mark, then they should always search for help. I always say, if you've been struggling for 6 months and you want to know if everything is okay, then you should search for help and not wait for those 12 months to be classified as infertile.
Right. So I don't know about your country, but in India, it's understood that infertility or fertility issues are a couple's issue. However, the responsibility and the stigma seem to lie on the woman more. What, in your opinion, causes this?
So yeah, infertility is a couple's issue. I know sometimes women go for independent reproduction and they try to get pregnant on their own as single moms. I think what causes this is that for a long time, infertility was seen as a female disease. So people wouldn't really, investigate or search what was wrong with the male if it were a couple. And so everything would fall on the woman. But historically, this has been true for a long time. It would be, the woman's place to make sure that she would get pregnant or not get pregnant, even if she couldn't control it. So I think it's historically something that has been building up. And it's only been, in the last 20 years that I think people have been starting to understand, the male side of it is literally 50% of the equation. So
it goes both ways.
Oh, absolutely. Even statistics show that infertility, it's caused 50% by female factor and 50% by male factor, or sometimes both, but it's pretty well divided. So the problem could rely on both sides.
That's fascinating. And yet women get blamed.
Yes, absolutely.
That's so unfortunate. So what are the psychological impact of infertility in both men and women? Could you tell us, and could you differentiate it for us?
Yes, of course. So there are some differences country to country. Yes. Of course, a lot of the beliefs that we hold associated to fertility differentiate. But if I had to say, fertility is a disease that mainly makes people feel excluded from society. They feel different. They feel like it's something that other people don't talk about. They feel like it's less common than it actually is. So when people come to, find help, what they say is, I feel so alone. I feel like no one else is speaking my language. I feel like I'm the only person with this problem. So I think loneliness is the first problem. I would probably say women refer to it more than men do, but also men take a lot more time to find help. So it's only been very recently that men have been, accepting the idea of, going through therapy and all of it, because it's a bit more difficult for men. So men feel a lot more shame, or a lot more like it's something that I can't fix. So it's difficult for me to deal with it, because men like to be very hands-on and practical. And then I think it's also related to that desire of being a parent. So apart from loneliness and from shame, people who can't become parents feel like part of the meaning of their lives is missing. They've been denied such a natural thing that, we always think happens so easily. It's just a big shock for them that it's not happening for them.
Right. Added to that, I think, is males have been recognized as the breadwinner, as the provider for all these centuries, and here you are, all of a sudden you can't reproduce, and maybe it chips away at the entire identity of the men too. I'm only stressing on men because, like you said, women find it more easier to seek help. We talk a lot between each other, between our mothers, sisters, and everyone. Men, they digest a lot and keep it within themselves. Yeah, and yet absolutely. They also suffer the same, right? The process is the same.
Yes, that's really interesting. So women, let's say they lose a pregnancy. They had a miscarriage.
Right.
So they feel grief, they feel pain, they feel super bad. They try to talk to some friends. If they can't talk to friends, they try and go to therapy. And they start talking with people that they know, expressing their emotions. They try to work it out. But men sometimes don't know how to approach this. So there's a really interesting name in literature that's called double disenfranchised grief. Meaning that men not only see their ability to grieve being denied by society, because boys don't cry, so men can't grieve, but they also see that being denied by themselves. They don't want to see themselves as being weak. They don't want to see themselves as having to recognize that they are suffering. And of course, this is a cultural concept, but it just makes their pain a lot greater.
Right. More heavier.
Yeah.
In the aloneness.
Absolutely.
Oh, I understand this a lot. Okay. So on a typical day for Beatriz Regina, and a couple comes to you seeking help, what is that one standard advice that you give them?
As a couple,
yes.
Normally people need to work on learning to validate each other's experiences. I think we are very used to couples who don't communicate a lot. They don't open up to each other. So when one person says, I blame you because you didn't do this, and the other person says, well, I blame you because you didn't do that. So we keep, our entire lives just pointing our fingers at each other, but we aren't able to look at each other and say, I understand what you're going through. I'm sorry that this is happening. I can't do anything differently. I'm trying. Being vulnerable with each other and being able to validate that we have different experiences sometimes seems so easy. I've rarely seen people do it. So they just keep blaming each other. And I think that can wear a couple down.
True, very true. In many parts of the world, my country including, the male partner, they're reluctant to take the blame that they could be the contributing factor of fertility issues in the couple. Have you faced that in your patients?
Yes, absolutely. I won't be too specific. I have never had a couple come from India, but I've had couples where it's really difficult for the men to accept. It was it was a diagnosis based on their sperm quality, for example, and if they had to go through a process of sperm donation, so getting pregnant with another man's sperm, sometimes it's really difficult to accept that. And some couples just can't go that extra step and accept that that's the only way to go forward. But I think it's mainly rooted in the fact that for a long time, men were never told that sometimes fertility is not associated with their masculinity. They don't become less of a man just because this is happening.
Right.
And I think this is really powerful, and we don't really take a long time out of our days to think, yeah, I'm a man despite whatever this diagnosis says.
Right. So coming back to the question about a couple coming to you for help. So if they're feeling anxious, or you find that they're suffering from depression, which is infertility-induced shame, how do you take them? What's your process of treating them?
It depends. Anxiety is one of the most reported experiences in infertility. Yes, it's anxiety, exactly. So it's not just about not being able to conceive, but even if they go to a clinic or they start treatment, they will probably feel anxious in various points of their journey. So normally what we do, isn't it?
Yes.
It's waiting for a consult, it's waiting for your results to arrive, it's waiting for when can I start treatment. It's so many things, isn't it?
Yeah.
So with anxiety, what we normally do is we try to validate that it's normal that they are feeling anxious. We try to identify some triggers or some stress points where people react more or become a lot more vulnerable. We identify these triggers. We study a little bit how can they be able to handle them in that moment effectively, but also how can they self-regulate their emotions, how can they self-regulate their thoughts. And we then sometimes even do some exercises of role-playing or just trying out some different exercises to see how they respond to it. And in some cases, people might need help from a psychiatrist to take some medicine to help them calm down or sleep better. It hasn't been the most common thing. So far, people have been able to calm down pretty easily. And then we have specific interventions for specific waiting periods. For example, when women are in the 2-week wait to see if the transfer worked out, we have some techniques, for example, a PCRI card, which is a positive cognitive appraisal intervention. And what it means is that we make a card with some reminders, positive phrases, some visual cues that might help the women remember why they are going through that process, that might help that person to ground themselves again and remind themselves, okay, I know this is a terrible period, but I know why I'm doing this. I believe in my ability to go through it. So that's one of the specific interventions for infertile patients. And also we work on mindfulness, meditation, breathing techniques, movement, yoga. And also if people have like a religious component, that can also really help. Some people like to pray. That can also be very, very calming and can work really well for anxiety. Now for depression, it depends. We need to see where the depression is coming from. Yes, there are different kinds of depression, isn't it? I've seen some tough cases, mainly associated with grief, normally associated with loss, sometimes with death. And what works really well for these people, in my experience, has been support groups. So I organize some support groups between patients, and they come and they share their experiences, and we work as a group to overcome the losses that they've experienced. Normally I go with some models. I'm going to go super scientific now, but normally we use integrative CBT models. We can use art therapy to express themselves, and we can use something called cognitive narrative techniques for grieving people. So there are different techniques that we can use, but absolutely they are studied and they are well evidence-based to make sure that people can work through whatever it is that they are going through.
So in all this process, self-regulation is very important.
Absolutely. It's knowing yourself,
yes,
identifying what's going on inside of you and all around you, and then being able to inside of you self-regulate whatever it is that you're feeling, that you're thinking. And this seems so easy, so but it normally isn't.
No, it's not.
Really easy to self-regulate, isn't it?
Right. So yes, I was looking at your workshop the other day on pregnancy loss and infant death. It's very interesting. Could you tell us a little bit more about it?
Yes, so this was a webinar that a doctor in Australia organized, and her name is Natasha Hogan. And so she invited me on that symposium to talk a bit about infant death, pregnancy loss, but other kinds of losses that happen in the fertility process. Sometimes we think about loss as just being death, the death of a child, or a miscarriage, but there are other kinds of losses, isn't it? We lose other things whilst we are trying to get pregnant. Sometimes we lose our identity. Sometimes we lose our sometimes we lose our partner. Sometimes we lose the ability of having our own genetic material in the embryo when we have to do donation, for example. And so the symposium was a bit about that. All kinds of losses that you can experience in a fertility journey.
Oh, so you did your sharing. It must have been a very enriching experience for you.
Yes, absolutely. We had other speakers come on the symposium as well. Some with professional experience, some with personal experiences. So it was really interesting.
You said that support group really helps.
Yes.
And I agree with that 100%. So now, I think in my country, India, we don't have any support groups for people with fertility issues, if I'm not wrong. Is there an online support group that people can come and attend?
Yes, absolutely. So if you go to my Instagram page, I have a link in my bio, and people can sign up to support groups. And if they want, I can organize by country. So a support group for Indian people. And sometimes that's important because of the culture.
Yes,
and we want people to feel comfortable. And we do them online. Absolutely.
That's very interesting. I think we should, as a country, also focus on that. Yes. So the other interesting thing that I saw your work you doing was your work with the LGBTQI plus community on infertility. Now, that's something that I have never seen anyone do.
Oh wow, it's an emerging topic here in Europe. It's becoming more and more common to work on different options for different people. So for example, if we have a couple of two women who want to get pregnant, we have the ROPA method, where we use the egg from one woman, but the one who's pregnant is the other woman. So both of them are sharing the process of being pregnant. We have to be mindful of, for example, transsexual people who have different challenges. Maybe they are taking different hormones. So yeah, absolutely. The LGBTQ plus community, are people who will be parents too one day. And so being able to adjust these options to everyone and being as inclusive as we can, I think it's really important for me too.
At the end of the day, there are people with the same emotions as us.
Absolutely. Is it something common in India to see a lot of people who are not heterosexual?
Yeah, I think it's a rising trend. I don't know what word to use. but it's more often seen now versus 10, 15 years back. People are more open about it. So, ma'am, in your practice, you must have come across so many different types of situations in people. What is that one particular, incident that has left such a profound impact on you that you had to change your entire course of life and of your practice?
Yeah, I normally say that patients change me a lot too. So patients come to sessions and they are hoping that you help them, and you do, but they also have an impact on you. I would say that what has changed me the most was to see how much pain people can carry inside of them in silence. Not talking about it. And when you reached out to me and said, in India, we don't really talk about it. I think that's pretty painful. People suffer in silence and they never have the ability to talk to anyone or to find help for their problem. That has changed me. I didn't know that it was that common. And I've seen that happen almost with everyone that I've seen, that they feel like they are suffering in silence. And that changed the way that I approach sessions. I think it has changed a lot. How I empathize with people as well.
Right. So we are all like individuals existing in our silos, each thinking that we are alone in our suffering. But if we only reach out for help, then it gets lighter.
There are more people. Yeah.
Yes.
There are more people who can help you carry your burden. Yes. That's fine.
I saw that in the WHO article, I saw that 1 in 6 matured person who are of the child reproduction age is suffering from infertility. And that trend is going to, I think, the number is going to increase.
So isn't it such a large number?
It is.
It's a lot of people.
Yeah, and the other day, before, I was just thinking, 7 billion people, So I was just thinking like that. But now I have to take out people who are minors, who are way beyond the reproductive age. And then the numbers is like astounding. It's really crazy. And it's an epidemic, right?
Yeah, it's a rising number of people struggling. I think there are a lot of studies about it, but there was one in particular that I found really shocking that said that in the last 50 years, sperm quality in men had decreased more than 50%.
Whoa. In the last 50 or 15?
so 50 years.
Oh.
But it's still a lot, isn't it?
It is a lot.
To see, sperm quality decrease that much. It's shocking, I think.
What do you think is the contributor for that decrease in sperm quality?
I think there are a lot of things that can have an impact on it. I think sometimes people aren't aware that what they eat, their exercise has a great impact on the sperm quality, but also sometimes we are exposed to a lot of chemicals, to a lot of air pollution, water pollution. If we don't live in a place that, has a good water quality, all of these things can have a big impact on our sperm quality. And I mean, I don't know if this is the case in India, but some studies indicate that when some sub-regions don't have, access to clean water or good food or anything, malnutrition, all of this has an impact on your sperm quality as well. All of it.
So besides the recognized age issue, it's the environment that we live in, the food that we consume.
Absolutely.
All these are contributing factors.
Absolutely.
Right. So here's one last question. In your country and in UK, is there a law that protects a woman or a man being discarded because they are unable to bear children or impregnate the woman?
You mean discarded from society or?
Discarded from the marriage, given a divorce?
No, there's no law against it. So it's pretty liberal if people aren't able to conceive. That's like a personal issue. No law dictates how people should relate to one another. You know, people can marry whoever they want, and that's pretty open.
Last question, and this is on a personal front. You are leading a very busy life, working in a company, you're volunteering, doing social work, going to different talk shows and attending interviews. What do you do in your free time?
It's a great question. What do I do in my free time? So I really like to read, and I try to keep up to date with new interventions. So I think I'm always working, even when I'm off work, because I think it's a 24/7 work to care for other people as well. So I like to be updated when it comes to new interventions, new concepts, new projects out there about fertility. So I'm doing that a lot in my free time. But I also like to write. I think that's something that helps me as well, focus a little bit more on myself. And that's a great question, because I think we need a lot of work-life balance to be a common practice, which sometimes I know sometimes I get a bit off balance, but yeah, I mean, reading and writing, I think that's what I do most in my free time.
Don't tell me that your writing is also just work related.
Oh, no, not always, absolutely not. No. No. It's not always work related. Absolutely not. But I think it's something that I also try to pass on to my patients, that they need to have time for themselves as well.
True.
And so I try to do the same for me too.
Right. So we've had a very impactful and very eye-opener of a session on the psychological impact of infertility in both men and women. Thank you so much, Beatriz Regina, for taking time out of your busy schedule to be with us.